When I first started and I was given a tour of the hospital, he said, hey, and this is so-and-so. And then I went another 10 feet. And this is his wife, the so-and-so. Went another 50 feet. And this is his son, so-and-so. I'm like, I've got to watch what I say in this hospital. Everybody's related. And that just shows you the strength of the community, right? It's a family and community hospital.
Nice.
But with academic quality in terms of providers.
Hi everyone, this is Amy Valdivia, and this is the Just Ask Upland podcast, where we are highlighting our entire Chamber of Commerce community. I am super excited because why? We have been voted the best chamber in the Inland Valley. And of course, we are here with one of the greatest representatives of our chamber, Mr. John Chapman and Miss Michelle Stoddard from San Antonio Regional Hospital. This is my favorite interview. Yes, I'm putting it out there. I'm letting everybody know. No hurt feelings, but I have been waiting for this interview for such a long time. Mr. John Chapman is the president and CEO of San Antonio Regional Hospital in Upland, California. Mr. Chapman joined the hospital in 2018 and is currently serving as the 7th president and CEO in the history of the hospital. San Antonio Regional has 363 beds, a staff of over 500 physicians, 2,000 employees, and 300 volunteers. The hospital offers advanced patient care throughout the Inland Empire. John is Lean certified and represents in the Inland Empire as the board member of the Hospital Association of Southern California. John has also served as an experienced hospital exec for over 2 decades. Prior to arriving at San Antonio, he served as COO at Highland Hospital in Oakland. John was not only in charge of operations at this 169-bed general acute care hospital, but also led the clinical support services for the Alameda healthcare system. Some of his accomplishments included Alameda's accreditation as a Level 1 trauma center and a baby-friendly designation. In May of 2021, Michelle joined San Antonio Regional Hospital as the president of the San Antonio Hospital Foundation. Michelle has over 30 years of fundraising and relationship building experience in both healthcare and higher education. Her fundraising experience in healthcare includes serving Glendale Memorial Hospital, Casa Colina Centers for Rehab, and Emanate Health in San Gabriel Valley. Michelle also served at Cal Poly Pomona's University Advancement Division for over 10 years in a leadership positions, culminating as interim vice president for advancement during a successful $150 million comprehensive capital campaign. Michelle can raise some money. Professional affiliations include Southern California Association for Healthcare Development, Los Angeles Planned Giving Council, and the Pomona Valley Council for Estate Planning. I am so excited because the information that we are going to receive today is not only amazing, but it truly tells about the support that we have in our community. We have an institution that sits in our city that not only takes care of those people that live right here in Upland, but our reach over the most recent few years has grown. And we are recognized nationally. It's amazing. This hospital means so much to me. Who better to hear from with all the statistics and all of the background information, John himself. San Antonio Regional Hospital, pillar of the community. Give me a little bit of history about the hospital and tell me what your role is.
Sure. Well, I had to learn about the hospital's history too.
Right.
It goes further back than my age. In 1907,
Wow.
Dr. William Craig apparently had opened a 18-bed hospital. I don't want to get this wrong, but it's not the current site.
No.
All right. It was on Arrow and San Antonio.
Correct.
Right? And then it was Francis Mary Paul who came along and expanded and relocated the hospital to where it currently is today. In fact, when I started, I was really excited. There's my first office actually had 2 stairs that went down. I'm like, this is cool. And then I found out it was actually the staircase, the original staircase of the front entrance of that 1923 hospital.
Wow. That's awesome. And she wrote a check for how much?
I think it was, Michelle, you might want to help me with that.
$75,000.
75,000, yeah.
And here we are. And now it went from 100 beds, 100 and some beds, to how many?
Well, with her, it was at 24 beds in when it originally opened, but today we have 363 beds, and we have plans and construction going on for more.
Wow. And so the communities that we serve include?
Well, that's where it's grown from a community to a regional hospital. First was Upland, and I'll say the concentric 5-10 mile circle. But today, a lot of people don't know that in terms of market segment, and market segment's the number of community members that come to our hospital, we have a higher market segment than Kaiser. We have a higher market segment than Pomona. We have a higher market segment than Riverside. So now you understand why we're called regional.
Right. Wow. So when you're talking about this market segment, we're talking the entire Inland Empire.
All the way down to Riverside.
From, shall we say, Claremont, Pomona?
Yes.
All the way up.
I would even go further and say East LA. That's part of our catchment area.
Wow. Well, it was San Antonio Hospital. This hospital has taken care of my family multiple generations. And then the R designation hit. And I remind people that it is still the local community hospital. We just have access to greater health care. Then all of a sudden this pandemic thing hits, right? And oh my gosh, now we're caring for a whole bunch of people. Tell me about what happened during the pandemic.
Well, they blamed it on me because I'm a microbiologist by training, and then COVID hit. I'm like, oh, my luck. But actually, we have a fantastic group of physicians. One of the great things about being a nonprofit independent hospital, it allows you to make decisions quickly and pivot quickly. So God knows, during COVID, everybody was pivoting.
Right.
More than once.
Right.
So unfortunately, we had the highest number of COVID inpatients, again, in both counties, San Bernardino and Riverside.
Wow.
At one time, our census, these are not people in the ED, these are people who are admitted, our census just with COVID was over 200. That's huge.
And in the ED, there were
Sure,
countless.
People were coming in, countless. I'd say the average census in the ED at that time was 300 to 350 a day, either having COVID but not to a point where they needed to be admitted. So of course, we were one of the first hospitals who actually came, if you remember this, monoclonal antibody therapy. No one was offering it, not even in LA, and we were the first ones to get it. So I like the forward thinking of our doctors and our administration. We were one of the first ones who had 3 different molecular platforms to detect COVID. And we did 3 because we didn't know if supplies were going to run out with 1. So we wanted our staff and our patients to feel safe, knowing that every patient who was getting admitted was screened, right? So you didn't want to have a COVID patients with a non-COVID patients, but many hospitals in the area at that time didn't know. The other thing that we saw that we were really proud of was we had individuals traveling all the way from LA to our hospital because they had heard about these novel therapies that they had read about in the papers or heard from Dr. Fauci. And we were one of maybe 2 hospitals in Southern California who offered it. So that felt good to our staff. Remember, my staff here is seeing a bunch of sickness, death. You guys might remember the picture of morgues outside every hospital. The other thing that made them feel really good, and I think helped to wed the community even more so to San Antonio, is did you know that we vaccinated over 20,000 seniors?
Really?
Yes.
I had no idea.
That's right. So we really wanted to really justify that San Antonio is the community's hospital. We care about you. We're putting the community and we're putting the patient first. And we continue to do so even after COVID.
It's amazing. Some of the stories we heard and we saw on TV, you know, it was the morgues. There was a moment I remember hearing about makeshift rooms in the parking lot. and having to pivot quickly because you couldn't put this asymptomatic patient in with that other person that actually could go downhill pretty quickly. But maybe somebody needed treatment and they were outside and it was cold, and I'll never forget that call. One of the doctors talked about it was freezing. It was New Year's Eve, and they were sitting outside treating patients because they needed to get to everyone. You had to get creative quickly because you couldn't have people sitting in the cold.
Right.
What were some of the things you did internally?
For those people who still have conditions that aren't COVID, we're afraid to come to the hospital.
Right.
So it's a catch-22. They're afraid of catching COVID and perhaps getting very sick and even expire. Versus, am I having a heart attack? I'll take my chances. Maybe I'm not, and that's bad news. So how do we convince those individuals it's safe to come to the hospital? When we did identify a COVID positive patient, we cohorted them together, and to keep them out of the main ED where you had children, City of Hope, affiliated cancer patients coming in, and I can keep going on with different conditions. We wanted to make them feel safe in our ED too. So isolating a COVID patient is exactly what you do, whether they're in the ED or upstairs on an inpatient ward. So we learned lessons, right? You saw a number of hospitals throughout California and the US with tents out. We had to as well. And in those tents were COVID patients, identified COVID patients. So how do you make a tent comfortable in the middle of the night? Kind of hard, but we actually had OSHPOD waivers, and we put in heaters in there. We ran electrical. Eventually, I'd say day one, not a great time to be in a tent. Maybe by the third or fourth week, it's okay.
Better.
Not as many complaints.
One of the outcomes of the pandemic was not just about healthcare and taking care of your immune systems, but it was mental health. And morale became a big issue, especially amongst the physicians and the nurses. This great exit that we heard about. Talk to me about that, and what did San Antonio do to combat that during that time, and what are you doing moving forward?
That's a great question. So a little history at that time. As you can imagine, what we knew about COVID was minimal at that during 2020 and early 2021. So a lot of healthcare workers says, I don't want to deal with this. I'm afraid. I don't want to bring it home to my families, my mom and dad, my kids. So they actually said this was the Great Resignation. They left hospitals. In fact, over 330,000 healthcare workers throughout the US just packed up and said, I'm not doing anything with healthcare. So who fills that gap? Now imagine that. You have a hospital that's had 140% capacity with perhaps staffing that's at 70 or 80% of what it used to be. Immediately. Not a lot of time to react. So how did hospitals go about handling that? Well, that's where you heard stories of hospitals paying millions and billions of dollars to registry. One of the good things, luckily, when COVID came out, it was regional. There were hot spots in the US, not the entire US, like you saw with later strains in 2021. So we could get that staffing there. But regardless of who was there, could you imagine the stress and anxiety with dealing with patients, and what you're seeing aren't great outcomes? A good successful day is to hear that the mortality rate was less than half of the reported mortality in California, which I'm happy to say that was the case at San Antonio. And I think it's because we were able to try we were one of the first ones also who brought in remdesivir, and that's when that had worked at the time. But if you're a caregiver, how do you go home and saying, boy, I had a successful day? You don't during that time. We had times when patients, our first COVID patients had survived and were going home. Staff would actually line the front entrance in the hallways and clap for them. I don't know if people remember that. But I mean, we had to find inklings like that to make everyone feel a little better about themselves. And that's one of the reasons we also created vaccination programs. The first people we vaccinated, besides our own employees, we opened it up and said, you know what, you bring your family here. If you remember that time, finding vaccinations was hard.
Right.
So we appealed that, hey, we're your family too. And I think that helped. Still doesn't cure depression and anxiety.
Right.
We're still dealing with PTSD from that today.
Yes.
And that's why we are part of a Care for the Caregiver program that's sponsored by the Healthcare Quality Institute, where we provide that type of support to our patient, or to our staff who need it, and to our physicians who need it.
One of the things that I love to hear when you talk, how many nurses did you lose?
Oh, you know, we had a rate, I think, we do an annual rate, right? So I'll use 2021. I'd say up to 12% of our nurses just said, too much for me.
But in comparison to other hospitals,
Which was at around 23, 24%.
right, that's what I wanted to hit home
Yeah.
for the listeners. It was such a tough time. And we heard about this resignation period. We heard about the nurses, and we saw on the news people walking off their job, walking away from pensions that they were about, had they hung on for just another year or two, they would have had a great pension, and they said enough is enough. In our community, with people coming from far, far locations during a terrible time, we kept a lot of our nurses. Mm-hmm. We didn't lose any doctors, true?
No, we didn't lose any doctors.
What does that say about the hospital culture?
Well, I think it's because most of the nurses and doctors were from our community. They were supporting their community, it was just fantastic to see. I still get a little emotional when I think about it.
It's the service right back to our community, which now, let's talk about some of the next steps to help the newbies coming in, because you look to the community to cultivate the next group of doctors and nurses.
Yeah, this is the fun part for me, right? And that's, how do we keep our talent within the community, regardless of COVID? Because it's always been an issue, from my understanding in the Inland Empire. So we're creating multiple workforce pipeline programs. I just signed an agreement with the University of Laverne to develop pipeline programs for OR technicians, lab technicians, SBD technicians, certified nursing assistants, clinical lab scientists.
Oh my gosh.
And the deal is, hey, you developing, I guarantee you, I'm taking this amount per year in our hospital. I'm offering them jobs before they even graduate, contingent upon graduation and certification. So let's keep it here, and that's what we're doing. For nurses, Western University is a great choice. I did their commencement speech for their nursing. And one of the jokes I made is, I did the Oprah joke, I have an employment agreement under your chair for you. It worked. But the idea is, hey, I'm taking over 200 RN new grads per year. We're paying our experienced staff an additional several dollars an hour. Thank you for training them. They know it's going to benefit them, right, in the long term, but there's some work to train new nurses, and our experienced nurses, not one has balked. It's been great. So today, with an employee roster over 1,900 employees, want to take a guess of how many registry nurses I have?
Go.
I knew you weren't going to guess. We have 51 out of 1,900.
What?
Yes, and I have a full staff of nurses.
Oh my gosh.
We're doing well.
That blows me away.
Yeah.
Holy moly. Well,
now they're all younger than me now, but still, we have a great crew.
now, you got to talk about the awards, because everything you're doing, the seeds you're planting, now we're starting to see, hey, people are noticing. and just think about what it's going to do for our future.
Everybody likes awards, but I like the ones that have meaning, that say something about your organization, right? So I love when I had a board member who just became of Medicare age, said, they told me to look at the Medicare Star Report online at hospitals and choose a hospital of my choosing. I didn't know that we had the highest quality star report in all of East LA, San Bernardino, and Riverside, even over some of the larger academics who I won't mention here. So that felt good. And then we've won a plethora of women's care awards. And that's really important to me, because now we're getting into health, equity, diversity, and inclusion, right? The really appropriate way to treat the health of the community is not a one-size-fits-all, but what do they need by social determinants, whether it be income, ethnicity, age, which we can talk about in a second on how we're handling that. So it's not a one-size-fits-all model, and we're doing it based on social determinants.
Talk about age.
Oh, I'm glad you prompted me for that. I'm excited. We actually bought the Mercury Insurance building in Rancho Cucamonga. And for those who know it, it looks like the Taj Mahal. It's fantastic. Why am I excited? Because I know seniors like my mom care about how a building looks, if it's professional, if it's easy to get to, if it's great parking, and we're making it our center of aging. And what is a center of aging? Well, for those who are listening, I'm sure you've dealt with a senior, whether it be your own parents or perhaps you know of a neighbor or so, or a relative, who can't get around. And when they can't get around and they have to go to multiple medical appointments, how do you get them there? Do you take off time of work? If you use an outside company to do transport for a wheelchair, even with Medicare, it's still like a $140 copay. So we're creating a venue where a senior can get, and I'm hoping, almost 99% of their outpatient care. Meaning, I'm gonna have PT, OT, lab, imaging, falls center.
Wow.
I'm gonna have ophthalmology. It's big in the senior. Where are they gonna get their hearing aids fixed?
Right.
That was a big thing with my mom. I'm like, oh my God, I have to go somewhere else. A large national company did not have that at their site. I won't name who that is.
You're not competitive at all, are you?
Not at all. I left. Not, no. And then when word came out, in 2 days, I've already had 8 different primary and specialty medical groups saying, I want to be part of that plan.
That's awesome.
Yeah. I had Optum leadership say, I want to be part of that plan.
Very, very cool.
So yeah, I'm really excited about what that's going to look like in the next year to two.
As we grow, and I keep saying we, because I'm very proud.
Well, you are wearing San Antonio colors.
That's right, that's right. I'm very proud to be part of the foundation board, which Michelle and I will talk about. And 100%, everything that you're doing is supported by the foundation.
Yes, this person next to me is very important to me, so I let her tease me all the time. As long as she continues to succeed like she is on finding funds, she's my best friend.
Michelle Stoddard. First of all, tell me why. Why do you do what you do? How did you even get involved in development and raising funds? My goodness gracious.
Oh, well, that's going way back. But
Please share.
My mom was an avid volunteer, and she took us along with everything she did. So I was raised in a volunteer environment. But for me, why I enjoy it and why I went down this career path was connecting people. I really enjoy people and getting to know them. And I think that when someone finds satisfaction sharing their time and their treasure, that it only builds on that. And serving in a community that is so community-minded and a hospital that has the culture that it does, it's just a good for me.
In your bio, you weren't always focused on healthcare.
I took 1 decade off and was in higher ed, yes, but for the most part, I've worked at acute care hospitals and one rehab hospital.
Going back to our maternity unit, that's what our next big project is.
We're getting the word out there. We're waiting for plans and a definite idea of what this will look like. And then we'll be able to chop that up and go out and talk to people about different naming opportunities and how they might support. I cannot go anywhere or have any conversation with someone in the local area and not hear, oh, I was born there. Oh, my kids were born there. I know someone who was born there.
My 2 children were born here, and my 5 grandchildren were all born here.
So with a history as long and rich as San Antonio, I'm sure that this is going to be a fun campaign to embark upon. Knowing that there's a safe place and a comfortable place and a fun place for babies to come into the world, I think that we'll have a good time doing this particular capital campaign.
Tell the listeners why even have a foundation? Number one, why is it in existence? And then the whole process behind it.
Dr. Craig, back in the early 1920s, called on Frances Mary Paul to help out with some fundraising. So this is not something that just came about within the last few years, but having an actual foundation, a department, around the mid-'80s is when most hospitals formalized that process or that department. And to hold the status of a nonprofit, part of that is to have a fundraising arm. We only fundraise for San Antonio. We oftentimes get calls and people will say, well, will you support this? Will you support that? And our funds really need to go direct to the programs and services that are being offered at San Antonio.
And there are multiple groups that support the hospital, or the foundation, I should say. Ladies Legacy, which I'm a proud member of, and I know that there are many women in our community that are members. Tell me a little bit about Ladies Legacy, our history, and what we're doing. Well,
Ladies Legacy started a few years ago. It was the brainchild of a couple of different people. There was one idea, another idea, and it all came together. Financially, it's easy to be a member of. We're not asking people for thousands of dollars to join a club. The monies go to a place each year that the women kind of decide upon. We offer up some different ideas and then come to a conclusion about where the greatest need is. And also, it's a great networking opportunity. We have a couple of very low-key, casual get-togethers twice a year, and it allows professional women in the community to get together and meet each other. So, it's twofold. It's not just for San Antonio, but it's a good networking opportunity as well.
Tell me the phases of a capital campaign, from start to finish. This is your gig.
Okay, I might tell these out of order, but to start out with, someone says, okay, here's a project that's coming down the pike. And he's sitting next to me. And this was actually been talked about before I came on board. It was already, the wheels were starting to turn. So we start fishing around a little bit and letting people know that it's coming and trying to determine who would be interested in participating or helping to fund a project like this, because the foundation will be charged with raising part of the funds to make this happen. So we will eventually have a kickoff event, and we will be very public. There'll be some PR and some marketing going on about the campaign and what the funds raised are going to do for the hospital and the community. And we will have a big celebration and a ribbon cutting for a brand new maternity unit.
Fantastic. We have an event coming up, the golf event, and then we have the fall celebration. Yes. Tell me a little bit about those events.
The golf tournament, it is a very popular event. Over the years, it's grown in popularity. And the monies over the next few years will go towards our campaign. So even though we aren't public and really out there talking about this campaign, we are currently raising money for that. In the fall, we'll have our fall celebration, and that has a different theme every year. Although the foundation coordinates these events, we are a small group, and there's no way we can pull these things off. We have very strong volunteer support committees for both of these events, of which you are a part of. So we rely heavily on our board to point us in the right direction of where we might encourage people to participate in events or making outright donations. And so those are the two main events that we have, along with the Ladies' Legacy.
Where are your dollars going?
We have a ratio, so income coming in to expenses, and we raise anywhere from, it usually hovers right around $1.8 to $2 million each year. So we have been very fortunate in the last couple of years to have a couple of windfalls, and so our ratio looks much lower. The monies that we bring in, we run a very tight ship. We need to be very aware of our expenses because people do ask those questions, as they should. People should understand that, money is not being wasted. I'm only talking about the foundation. I know that's true every week when we sit in a leadership meeting. Those questions get asked at a much higher level. So I know that we always keep our eye on our expenses. And so if that question gets asked, it's very easy to say we run very lean.
So I want the listeners to realize that when you're looking to donate funds, look at who you're donating your funds to. Look at what's happening in the background. Are they spending money on these exorbitant amounts of salaries and supplies to really look pretty? And are those brochures just costing an arm and a leg? Where are you donating your money? Think about places like San Antonio Hospital Foundation. They're making sure that our dollars are spent wisely. And I want to know who's going to be the first to step up. 1 million. We need 1 million to get started with this next campaign because the maternity unit is going to be awesome. The moms in our area are going to have a fantastic facility, 100% dedicated to themselves, their newborns. They'll be segregated from potentially some sick people in the hospital, and they'll be cared for in a way that is meant just for a new mom. 1 million, that's what we're asking for just to kick off this campaign. One of the most difficult transition periods that patients go through is if they need additional care after their initial stay, if they need prescriptions. You have solutions or ideas to combat these situations.
I'd be happy to
Share.
talk about it, right? So when you think about readmissions, why do people who you think are healed, who are discharged from a hospital, who were an inpatient, or even in the ED, they were stable in the ED, but then something happens later, that's what a readmission is. They have to come back. What's the number one cause? And it's medications. Either the ability to get them, or the not understanding of what they should be taking, etc. So we're one of a few hospitals in California which will soon have a discharge pharmacy, meaning, God forbid if you were inpatient, but I'm going to use you as the example, Amy. Meaning if you were there, we can give you up to 30 days of every prescription that you need after discharge before you leave.
That's awesome.
And no, you don't have to wait in the line. We actually bring it up to your bed. So it's part of the discharge plan. We're really excited. We think that's going to make a huge difference, especially again when you start thinking of inequities, right?
Right.
And we'll be able to explain those medications right in front of them in their language, with their caregivers, with their family, and it'll make a difference. Because now, most hospitals say, here's the prescription, go get them. It's the middle of the night. By the way, you should start that tonight, that antibiotic.
Right.
What do you do?
And they happen to have one pharmacist who can't go to the other window to talk to them, and they just take this medication home,
Yeah,
or
well,
not. Or
I think
sometimes
all
they
of
don't
you know,
even,
even with commercial pharmacists in the pharmacies in the middle of the night, they have one pharmacy in a city that's probably 30 miles away with knowing my luck. and no, that's a scary time. So we want to make sure they're comfortable, they have all their meds. If they can't see their doctor within the first 7 days, that's why we're willing to give them a 30-day supply.
Well, that's just it. I hope the listeners are realizing that. Behind the scenes, think about this. And this is something that I was educated on. Thank you. Think about this. You're discharged from the hospital. What's the first thing they say? Go follow up with your primary doctor within the next week or so. Who can actually get into their primary doctor that fast? If you have your prescription for 30 days, there's probably a good chance you're going to be able to get into your doctor within 30 days, and you'll probably be able to handle your next visit much better than maybe within the first couple days when you're still aching from whatever just happened. You will be better because you've had your medication. You will be able to speak much more intelligently about your stay. You'll be able to now think about what the next steps are for your next bit of health care, which now, go ahead.
And who's following up with you?
Right.
If you do have questions, that's
Right.
a gap. So we opened up a readmissions clinic. Now that's not for everybody. It's a pilot. It's been for the first year now, and we pick the highest risk patients for readmission. And we give them an appointment at our clinic within the first 7 days. And we tell them, if you can't get into your primary, you already know the date and time you're coming to see our physician.
That's awesome.
And they're going to check with you.
That's awesome.
And we're going to expand that. What we'd like to see in the next 2 years, in a phased approach, is actually community healthcare workers who are also giving you a call within 7 days, asking, do you have any questions? Do you have any concerns? Anything I could talk to your doctor about? So that's where healthcare needs to go with value-based care. The value component is to make sure you're well after you're done, right? So with your acute care stay or ED visit.
And going back to when you're staying at the hospital, now you hear people talking about the shortage of beds. And that's something that you have worked on and you're challenged with on a regular basis.
It is.
Moving forward, what's your plan?
Yeah, so when you talk about throughput, the biggest complaint that we hear from any hospital, and ours too, from the community here, I just love the social media. And I'd like to answer half the time at midnight. Wait, let me explain to you. Is, God, I was in that ED for 4 hours. Yeah, you will be. Yeah, 4 hours, you're lucky. I would recommend people, if you're going for something that you consider mild, urgent cares are the way to go. And we just opened up another one. We now have 4 or 5 in the region. I should say 5 yet, 4 in the region. One's coming, but I can't talk about it. When you are in the ED, be patient. We're going to take good care of you, and you're going to get out. However, if you are admitted, at least during COVID, there are times where patients were spending 2 or 3 days in the ED before they got a bed. They were still getting treated appropriately, but hey, I'd rather be in a bed than a gurney, right?
Right.
And unfortunately, that still happens at many hospitals. For us, it still happens maybe once or twice a month, where we just have this occlusion of patients that we can't get out. And what's the reason for that? Well, the workforce issues not only hit hospitals, it hit the skilled nursing facilities. It hit home health. It hit the ambulance drivers who are supposed to take you home. So what we're seeing is over 30 to 40 patients not needing to be in our hospital at night. That's 30 beds.
Right.
The most we've ever had in terms of patients waiting overnight in our ED for a bed was about the same amount. Catching it? Right. So what can we do? Well, we're going to be creating a transitional care unit where those 30 could go into another area of our hospital that's considered outpatient. Why don't we call it like a short-term SNF stay, skilled nursing facility stay? That's probably about a year and a half away. The other thing we're doing is we're creating another 24 beds in our observation unit. What is another thing we're doing? We're going to be buying our own 2 ambulance rigs, because many patients get discharged after 3. Trying to get a non-emergency transport to home or even skilled nursing facility, forget it. You have to tell them by 11 o'clock. So instead of an extra stay, we're going to take our rigs and take you home, or take you to the skilled nursing facility who's waiting for you.
those vehicles will be 100% dedicated to that.
Yes, and ours.
Nice.
Mhm.
You now are caring for a greater population, and you just talked about urgent care,
Right.
and that's part of your plan as well.
Yeah, and we want to put it urgent cares where they're needed, not necessarily always profitable.
Right.
Right? So one of the ahas from COVID is 70% of the patients in our area were of Latinx community, right? And Ontario, let's just say they had a severe shortage of healthcare facilities. So we just opened a beautiful new urgent care off of or on North Mountain Avenue to serve that community, and it's one of the one or two next in line to expand our primary care facilities to. There in Fontana, again, picking two areas that we think are underserved in terms of healthcare. We want to be it for the community.
That's awesome. And primary care, you touched on that. We'll have our whole own primary care.
That's the hope. And you know, when you talk about behavioral care, the appropriate model, a great model, is besides having the MD and the nurse practitioner and the support staff, is at least minimally 1 or 2 days a week to have a behavioral health care specialist there, because everybody's coming in with that as a secondary
Right.
or a primary concern,
Right.
where it's a handoff from your doctor to a behavioral health specialist.
I love listening to what you have to say because you give me the background information. There's a lot more to running a hospital than just a bunch of doctors and nurses running around and just, beds. There's so much more. What else do you have coming?
Yeah. So I just wanted to touch a point because on people waiting in the ED, if you're having a heart attack, you're not waiting 3 hours.
Right.
You're in 5 minutes. That's where people who have mild symptoms, they're the ones who are, if they want to be considered punished, there's people sicker jumping in line. So they're the ones further back.
Right.
Right? So if you got a bunch of sick people coming in at the same time and you have a sore throat, you're probably going to be waiting longer. I've got to take care of that person who may be having a stroke or a heart attack within minutes. So
Hence the fact that you need to use the urgent care.
there you go.
For the sore throat. Go to the hospital for the
Absolutely.
heart attack.
Right.
What else do we have coming up?
We're very happy because when I first started, I'll tell you this funny story. When I first started and I was given a tour of the hospital, they said, hey, and this is so-and-so. And then I went another 10 feet. And this is his wife, the so-and-so. Went another 50 feet. And this is his son, so-and-so. I'm like, I've got to watch what I say in this hospital. Everybody's related. And that just shows you the strength of the community, right? It's a family and community hospital.
Nice.
But with academic quality in terms of providers.
Right. And
what else is coming up? Sorry,
It's okay.
I'm remembering your second question there. We'll have a new Mother and Children's
I wanted
birthing
you to talk about it.
center. Yes, I make her laugh and other people laugh when I talk about the amenities, but my daughter and my wife are like, oh, I get that. So, why can't you have a good experience with when you're giving birth? Why can't we have hairstylists? Why can't we have mani-pedis?
Manis and
There
petties
you
right
go,
there.
right? And hey, isn't it nice if you had a central courtyard, the garden zen piece that now I have bought into, to take your newborn and your husband and your partner and walk around. So we are in the midst of planning for that, and I don't have to build a new building. We actually have a wing where that would fit. We had moved our new ambulatory care unit into another building on campus, and we did a fit test, and that's going to be our new Mother and Children's area.
Women's heart health.
Mm-hmm.
Go for it.
Yeah, I had mentioned previously a number of women's healthcare wards.
Mm-hmm.
Cardiology is huge for that. Cardiology in general at San Antonio. What's the banner that we put on top of it, right in our front door? We made it supersized so you could even see it without your glasses.
You had to get a dig in.
It
You
was
had to get one in.
We've been a top 50 hospital, not in the region, but nationally for cardiac care. And as we continue to polish that service line, now we have it for specific areas like women's health. And we'll have it for aging too at our new Center of Aging. So we're very proud of that.
The hospital is one of the largest members of the Chamber and actively supporting the Chamber. However, as a member, how has that membership and our community impacted you, what you're doing, and the hospital?
So our membership in the Chamber allows us an opportunity to be out there and be visible and participate in events and whatnot, but we also have an obligation to give back to our community whenever we can. So we are sponsors of other events. We participate in community outings as well, not just financially, but we also have a lot of volunteers from the hospital that participate, some of our care team members. So in an effort to build those relationships that will benefit the hospital, we're giving back to those that will also utilize the services.
And the hospital sponsored one of our premier events, Tour de Foothills. And we have San Antonio Hospital, Regional Hospital, had to make sure I said that correctly, on every single cycle hat. Do you know that? That's where you're placed.
I love it.
Yes, and that event is for the veterans. Hence the fact you were just talking about giving back to the community. You're right there supporting the veteran community. So I'm truly appreciative of that. Thank you so very, very much. John Chapman, what's your favorite place to vacation?
I'd have to say it had to be Hawaii, but there's a reason for it.
Of course.
My daughter, I went to Cal and I invested my time every Saturday taking her to losing sporting events. They don't have great teams. Just to get her, go to daddy's alma mater. So where did she got in, but where did she decide to go? University of Hawaii. So I had a lot of my time where I missed her and I wanted to see her. So I'd go, 3 or 4 times in a school year while she went to the University of Hawaii.
That must have been awful.
I know. What a tough trip.
I do like good hotels, but she would bring 3 friends and I'd be out and about because I couldn't get back into my hotel until 6 or 7 p.m. when, of course, they wanted dinner. So, but I still love Hawaii. Yeah, can't miss either island. I like it. When I say either, I like Oahu, especially with the type of events you can do out on the water. And if I wanted a little peace and tranquility, I can do Kauai or Maui.
Wow.
So that's it.
Okay, so Mai Tai or beer?
Oh boy, time of day. Mai Tai, I have to go with, when you're fitting in, right?
I'm surprised you didn't answer back with whiskey or bourbon,
I
right?
didn't tell you what I put in the Mai Tai.
Or both. Yeah, all of the above. That's how we end our day.
That's it.
Okay, what's your favorite sport?
Okay. I get abused because remember I'm from Northern California and I'm here in Southern California. So anytime my Giants, Niners, or Warriors are doing well,
I
know,
what?
right?
Oh my!
I know, but since I am opening a center of aging for the community. If LeBron James would like to donate, I'm fine with that since he is kind of up there. All right, LA fans.
Right.
Let's see, what, 48?
He's.
I'm teasing. He's 38.
I'm like,
okay.
we know
your sport is not basketball, but that's okay.
It's not, and it's okay. It's quite all right. Okay, basketball or soccer?
Well, this is a tough one for me. I was a goalie for 4 years. That means I didn't know how to play soccer. Sorry for the goalies out in the audience. But I love hoops. I love basketball. So,
Really?
yeah.
Oh, okay, so we lost to basketball. Well, I mean, it is really just playing soccer, just throwing the ball around instead.
Okay, you go with
same
that.
place, absolutely.
Sure.
Okay, a day in the life of John Chapman.
Uh-oh.
I know, dare I ask? Tell me what an almost perfect day looks like for you.
where it actually goes to my agenda for the day, because it never happens that way. It's always, hey, when you say to be nimble and being able to adjust, that's what, unfortunately, I think any leaders out there who, whether regardless of what industry, no, it's not going to go by the way you had pre-planned it the day before.
I thought for sure you were going to come out and say like fishing or something like that. No, he went to his agenda.
That's it. That's it.
Okay.
It's the OCD in me.
Now you're on the hot seat.
Oh, it hasn't been already.
What is the worst question he's ever asked you since you've been employed by him?
Where's the money?
Yes. No, the girl sitting next to you.
Where's the money?
He's ever asked me a bad question.
I'm getting old, and I know to active listen to everybody around me, not ask dumb questions.
Very politically correct.
Yes. And she's a superstar, so there's really not too many questions I have to prompt her with.
So should I ask what's the favorite part of working at San Antonio?
The people, definitely. We round with other care team members throughout the week, and that is the number one answer, and I have to agree with it 100%. We have bad days, but everybody knows that we can count on each other, and it's just a really strong team.
And I'd say that actually describes San Antonio in a nutshell. It's not just the leadership team, it's the staff. We go into those departments and you can see the camaraderie.
Tell me about what you do for your therapy.
I'm a grandma.
Oh, nice.
So I spend some time in my yard. I do love, that's Saturday mornings. Sometimes it stretches all day long. I don't grow vegetables or flowers. I just take care of the little things around the yard. But I thoroughly enjoy my 2 grandsons and a granddaughter on the way.
Will you be teaching them, having them right there in the garden
Oh yeah,
with you?
they already are. Yeah, they already are.
Very, very good. That's awesome. That's a great time.
So if people want to find out more about the hospital or how to give to the foundation, they can call the foundation or the hospital, either one, or they can log on to our website at www.sarh.org. Find out information about our programs, and there is a give button.
And the foundation is also on social media,
Yes,
on Instagram and Facebook, true?
yes, we're part of the hospital.
Thank you so very, very much. I truly appreciate your time. Thank you for being here today.
Thanks for having us.